Welcome back to the Score Builders Question and Answer podcast. This podcast provides members of the Score Builders team with the opportunity to explore challenging multiple-choice examination questions with students actively preparing for the licensing examination. Ready? Let's go. A patient presents with hypersensitivity in the distal forearm following a recent peripheral nerve injury. The physical therapist initiates a desensitization program involving gradual exposure to various tactile stimuli. What is the primary mechanism through which desensitization training aids in reducing hypersensitivity? Option 1, inhibition of nociceptor activity. Option 2, enhancement of neuroplasticity and cortical reorganization. Option 3, reduction of peripheral nerve inflammation. Option 4, stimulation of axonal growth. Desensitization training. Desensitization training is a therapeutic approach used to alleviate hypersensitivity following peripheral nerve injuries. It involves the gradual and repetitive exposure of the affected area to various stimuli, such as different textures, temperatures, and pressures, to help the nervous system adapt and reduce pain responses. This question is asking about the primary mechanism behind desensitization training. Notice that word, primary. This is an important distinction because desensitization training may have secondary effects on some of the other options listed. But we need to identify the main driver behind why this intervention works. Think about it this way. When you repeatedly expose the nervous system to a stimulus, what happens over time? The brain adapts. It learns. It reorganizes. That's the key concept here. Let's explore each of the options. Option 1, inhibition of nociceptor activity. Nociceptors are the sensory receptors responsible for detecting potentially harmful stimuli and transmitting pain signals. It might seem logical that desensitization training works by quieting these receptors down. And while it's true that pain perception can decrease following desensitization training, the primary mechanism isn't happening at the level of the nociceptor itself. Option 2, enhancement of neuroplasticity and cortical reorganization. Neuroplasticity refers to the brain's remarkable ability to reorganize itself by forming new neural connections in response to experience. When a peripheral nerve is injured, the brain's sensory map, known as the somatosensory cortex, can become disorganized. This cortical reorganization can actually contribute to hypersensitivity. Desensitization training works by repeatedly and gradually exposing the affected area to various stimuli, essentially giving the brain new information to process. Over time, the brain adapts and reorganizes its sensory processing pathways, reducing the exaggerated response to stimuli. Option 3, reduction of peripheral nerve inflammation. Inflammation certainly plays a role in nerve injury and can contribute to hypersensitivity. However, desensitization training is not an anti-inflammatory intervention. The goal of desensitization training is sensory retraining and neural adaptation, not modulating the inflammatory response. Option 4, stimulation of axonal growth. Axonal growth, or nerve regeneration, is absolutely critical following peripheral nerve injury. But desensitization training doesn't directly stimulate axons to grow. That process is governed by biological factors like Schwann cells, nerve growth factors, and the integrity of the nerve sheath. So when we strip away the distractors, the answer becomes clear. Desensitization training works because it harnesses the brain's ability to change and adapt, neuroplasticity and cortical reorganization. The correct answer is option 2. Let's explore the all-student data. 46% of students selected option 1, inhibition of nociceptor activity. 48% of students selected option 2, enhancement of neuroplasticity and cortical reorganization, the correct response. 4% of students selected option 3, reduction of peripheral nerve inflammation. 2% of students selected option 4, stimulation of axonal growth. This question is a neuromuscular and nervous systems question which represents approximately 24% of all exam items. This question is a foundations for evaluation, differential diagnosis, and prognosis question which represents approximately 33% of all exam items. This question is a level 1 question since the question requires students to possess basic foundational academic knowledge. Remediation of Level 1 questions occurs through academic review of entry-level content using textbooks, review books, Basecamp, and flashcards. Academic focus area. Looking to review related academic content? Check out page 116 in PT Exam, the complete study guide. Thanks for joining us on the Score Builders Q&A podcast. See you next week.